Men and women have different fasting windows that have been suggested, tested.
How do you feel about fasting?
I think that there's a good amount of data for intermittent fasting and the sort of cellular regeneration that happens when people are doing that. So I think that intermittent fasting is good when it works for you and if you're doing it in conjunction with a conversation with your provider. In mental health, we don't have as much data on fasting, but anecdotally, my patients who do fast under guidance have noticed a greater level of energy and greater mental clarity in the afternoon. I think it's potentially something we should be studying more, but we don't have as much data in mental health as we do in other conditions. I think it's good if it works for you.
And when people fast, how do you define a reasonable fast?
So when I speak about intermittent fasting or time restricted eating, I'm referring specifically to the fact that men and women have different fasting windows that have been suggested, tested, and usually for women, it's shorter than men. I'm not talking about not eating or restricting food for several days on end. I think that's a very different realm. And certainly it might work for someone, but they really should be speaking to their doctor about that. But time restricted eating could be something as simple as tapping into the fact that when you wake up, you just don't feel hungry and you have your breakfast at 11. And what I suggest to my patients who feel that way is it's completely okay. Have your breakfast at 11 and maybe have your dinner early at 6 and use that as the window that you are eating. Maybe go for a walk after dinner, don't eat too much later, and then the rest of the time you actually technically are fasting. So it varies for different people. I ask people to really use their body intelligence to understand what window works for them. Usually it could be about 8 to 10, maybe up to 12 hours for women and slightly longer in men. But again, everyone is different and we're much more in the era of more personalized medicine these days. It depends on how you feel, how you tolerate it, and speaking to your provider. Because, for example, if someone is on medication that requires them to eat in the morning to take those medications for absorption or to prevent side effects, that's a very different conversation to someone else.